Hi, this is a quick video to show you how you may use ICE, pathology requesting, to request a COVID test. So your toolbar here may look different for you, but if you look here, there's a blue bottle. So you click on that. Now, if you can't find that blue bottle, speak to your IT team to see if your toolbar needs adjusting to access that. Then you'll have a list of providers for this request. So again, your list may look totally different, but here we've got Hillingdon Pathology Lab. Yours might say Imperial or something different, but just if you click on that one, so you did a double click on that and it opens up the pathology request screen. Then when you look at here, you've got a couple of options. So there may be a COVID-19 tab on that left-hand side. And if you click on that, it's got a request for the COVID antigen swab test. And you can click on that and it requests it. Now, I'm just going to go back a step. So I'm just going to cancel that. Let's suppose you don't have that tab. So if you look under search on the left-hand side and you typed in COVID into that box, and again, it will show you that options, the COVID-19 SARS test. So if you click on that, it shows you some instructions from the lab that they would like you to follow. Again, the instructions may look a bit different, but it's just reminding you about putting a sticker of the patient's details onto the sample and about how to bag it. Okay, so then it gives you some prompts of options here. Now, again, we may need to talk to the lab about can that list be different to cover your scenario, but let's just say patient testing for the moment. And we press OK. And right at the bottom on the left hand side, you can't quite see it because my screen needs to scroll down a bit. But if you press here, continue with request, so click on that and it takes you to the next screen. So really it needs some options about details. So I imagine symptomatic, child in school. Okay. And then here's got requesting consultant GP. So again, this is really where the results will come back to that named individual. So you may need a quick discussion about who that is or who's on your list. But that needs to, and if you click on here, you'll get a drop-down list of all your options of people. I'm not going to show you that because it will just show lots of names of people at the practice, which probably is not a great idea. But that should be how you request it. Then on the right-hand side, you've got options of I want to fill specimen details later. That really means it stores the request, but it doesn't print off any form because you're not collecting it now. But imagine you're going to just go for the option that's clicked here, which is selected here already, which is print this order. And then it says to sample collection options, collect now, collect on a specific date or time, collect later. Let's just assume you're collecting now. So you're just selecting collecting now. Then at the bottom right, it says there's a box that says accept requests. So you click on that. Now it tells you it wants to print it. So you would just select your printer and it would print it. One option just to realize is that, you know, depending on the windows you're on, you have got an option to print to PDF. And this could mean that you print it as a PDF document. And then you could, you know, potentially email it or send it somewhere. So if you had to work centrally and you're sending a form to someone, and I'm just going to show you how that could work. So we just press plead and then desktop. If we just said swab, so if we said COVID swab form, golden phoenix. Okay, so just going to click it. Okay, so that's hopefully, and then if you press proceed, so again, you've done it. So it would have printed off to your printer if you'd printed it completely, or it's created that PDF document. Now let's see where that document is. You've basically finished and you would just say click on here to save the record and that will save everything. When you go to Tab Journal and you look at the actual patient's details, you can see your pathology form at the bottom. So there it's saved and you can access it. It just shows you that that request was done. I'm just going to minimize system one and just show you that form. So again, if you click on COVID, that PDF document, so this is it created as a PDF. You can see the test forms and the bottom, so top left, it's got the labels that would be printed off if you use the right paper to stick on the container. It's got the details, at the bottom, the collection date and time. So the reason I've showed you this as a PDF is you could email this form if you had to send it to someone else somewhere else, or they could try to access it in the record. If someone else somewhere else had access to System 1, they can go back into System 1 and access this request and try to print it off. Um, so this gives you some functionality about how you could manage the process. One really important thing is if you do something like this where you save it as a PDF, make sure you do delete it. If you've saved it on your local desktop or something like this, it's not secure. It's got patient identification, so make sure you delete it and delete it out of your recycle bin. Failing that, make sure you save it onto some secure drive if you're not doing it that way. Okay, hope that helps.